Is food making you ill? Are you thinking about having a food intolerance test? If you are, then here are some things that you need to know. A food intolerance isn't the same as having a food allergy. If you're allergic to a particular food, then you'll get an immediate reaction, and if it's severe, it can require urgent medical attention. Now, symptoms can vary. Things like mouth and lips tingling, there could be swelling of the face and throat, a rash, a feeling of tightness around the throat. And if the allergy is really severe, then a person might have difficulty breathing. So a food intolerance is not as severe and it's not as dramatic as a food allergy. So it's important not to get confused between the two. With a food intolerance, the symptoms can be so varied that at times they can seem unrelated to food. Now, it's not uncommon for people to say they have bloating and stomach cramps, diarrhea, constipation, migraines, headaches, weight problems, particularly losing weight, can be due to a food intolerance. But it can even give rise to symptoms such as depression and anxiety, asthma, hyperactivity, chronic fatigue, or even arthritis and general aches and pains. Symptoms can take hours or even days to appear, and it's estimated that 45% of people suffer from a food intolerance, and that's according to Allergy UK. So because of the wide variety of symptoms and the time delay in which they can appear, a bit of detective work is often needed to try and find out what the problem food really is. You can try an elimination diet where you leave out certain foods for a while, see if your symptoms get better, and then reintroduce the offending food and see if you get symptoms again. But it is based on guesswork, hoping you're going to eliminate the right problem food, and it can literally take weeks or months to eliminate different foods with no guarantee of success. So we aim to take the guesswork out of finding out if food is making you ill, and we offer a personalised food intolerance test and nutrition consultation at our clinics in Coventry and Nuneaton. We test for 59 common foods which are known to be the most problematic, and they include wheat, other grains, yeast, dairy and eggs, fish and shellfish, and certain fruits and vegetables. And in order for us to help you, we ask you to keep a diet diary for 4 days before you come and see us for your consultation. We use what's called the food detective test, and we find that it is the most effective, accurate and reliable test that's available to us. It's a simple pinprick blood test, and it looks for antibodies in your bloodstream which have been produced in response to an immune reaction to a problem food. We usually just prick at the end of a finger and take a very small sample of blood, and that's mixed with a special solution and poured into a reactor tray to process. After 35 minutes, foods which are a problem to you are identified by blue dots appearing on the tray. And we then give you a comprehensive list of the foods which are a problem. You get the results within the hour that you're with us, and we'll also give you guidance on alternative foods which are available to you and general dietary advice so that we can help you to feel well again. To book your food intolerance test at our Coventry or Nuneaton clinic, call us today on 024 7641 4421.